Unit 7, Task 3. 1. A hypertensive 50-year-old director of a small company.
The condition you have requires to be controlled to prevent future damage to the body, especially the blood vessels. If it's not controlled, you can have certain serious illnesses, such as a heart attack or a stroke. Treatment is therefore to prevent illness developing, because well, I'm sure that you don't feel ill at the moment.
No.
You'll have to take tablets or medicine, but you'll also have to modify some of your habits. For instance, you must stop smoking.
2. An insulin-dependent 11-year-old girl accompanied by her parents.
Now, Elizabeth, the trouble with you is that you're not making a substance that you need to control the amount of sugar in your blood. If you have too much sugar or too little sugar, it'll make you feel very ill, and we'll have to replace this each day. It means that you'll have to have a jab, because it doesn't work properly if we give it to you in a tablet. Now, your mother here will go with you to see the nurse, and she'll show you how to do it. Many other boys and girls, some much younger than you, soon learn to do it, so you needn't feel frightened.
3. A 65-year-old schoolteacher with osteoarthritis of the left hip.
This condition is really like the wear and tear of a hinge. The joint is becoming stiff and painful because it's roughened by inflammation. Fortunately, as you're now retired, you'll be able to modify your life so that it doesn't trouble you so much. I'll prescribe tablets, which will help the pain and stiffness, and although this won't cure it, it will control the discomfort.
Right.
If in the future it gets more troublesome, we can always consider an operation, which will get rid of the pain.
4.
A 23-year-old sales representative affected by epilepsy.
Unfortunately, the attacks you've been having are shown to be quite severe. They're caused by abnormal electrical activity in your brain. This is called epilepsy. But we can help you to stop having these fits. I'll prescribe tablets for you. These will control the condition as long as you're taking them.
Right.
Now, it's most important that you take them regularly and don't forget. The problem, as far as you're concerned, is that you're not permitted to drive for at least 1 year after your last attack. You'll have to consider changing your job. You must tell your employer about your condition.
5. A 52-year-old cook with carcinoma of the bowel.
The tests show that you've got a nasty growth in the bowel, which will have to be removed. It's far too dangerous to leave it. The operation has every chance of removing the disease. The exact type of operation, however, will depend on what the surgeon finds in the operation.
Yes.
There's a possibility that you may have to have an opening made on the skin of your abdomen. This is something a lot of people can cope with, and it may only be temporary.
6. A 27-year-old teacher of handicapped children suffering from a depressive illness.
I know that you feel this illness is something which affects your whole life. It's called depression, and we think it's due to chemical changes in the brain. Now, it's not something you can pull yourself out of. You'll need help in the way of psychotherapy and drugs as well. You may think that nobody else has ever felt like you're feeling, but let me assure you that this is quite a common condition. You will get well again, although it will take some weeks to feel improvement. Often it's possible to continue in your routine of work, because this gives you something rewarding to do while you're getting better. You'll get a medicine to take, which will take some weeks to work, so don't be more despondent if at first it doesn't seem to be helping.
7. a 6-month-old baby boy suffering from atopic eczema, accompanied by his parents.
This skin problem your baby has isn't an infection, so he can't give it to anybody else. It's a condition which affects the skin and will require ointments from time to time. Sometimes it will seem better and then it may flare up again.
Right.
It's not absolutely certain what causes this problem, but it can be hereditary.